Good afternoon and welcome to the City of Toronto's COVID-19 media briefing for Monday, March the 8th, 2021. Joining us today is Toronto Mayor John Tory, Toronto Fire Chief and General Manager of the Office of Emergency Management, Matthew Pegg, and Toronto's Medical Officer of Health, Dr. Eileen de Villa. Mayor Tory?
Well, good afternoon and thank you, Brad. I want to begin by acknowledging that today is International Women's Day. And while it's a day to celebrate the milestones that we have hit, and to celebrate the women in our lives that continue to inspire us and to uplift us, it is also a day to acknowledge how much work we have left to do, especially in the aftermath of the pandemic. Two examples to cite as evidence of progress made and yet a huge mountain left to climb. On the progress side, I'm able to report, as one of many examples I could offer, that as of 2021, 52% of our public appointments made by the city are held by women. And yet, at the same time, on the other side, a study just issued by RBC says the following, and I quote, "Almost 500,000 Canadian women who lost their jobs during the pandemic hadn't returned to work as of January. More than 200,000 had slipped into the ranks of the long-term unemployed, a threefold increase over last year," close quote. In a pre-pandemic world in which women were still struggling for equality with men at home, at work, and in a number of other areas in life, the pandemic caused a setback, with many women losing jobs and job opportunities. So that should mean an even sharper focus on this today, International Women's Day, and in the many months of post-pandemic recovery, which must try to address many issues of equity, including those related to women. We have great news to share today on the COVID front. First, the city has now administered, as of Sunday, more than 200,000 vaccinations to Torontonians, including tens of thousands to people 80 years of age or older. Second, that effort continues today, as it will over the course of this week, with some 17 clinics open across the city today, vaccinating thousands more Torontonians, including many over the age of 80. And third, we are announcing today an imminent and significant expansion to the overall Toronto effort now that we have received assurance of more vaccine supply. I'm proud to announce that the city will be receiving enough COVID-19 vaccine doses based on the schedule outlined by the province. We'll be receiving enough COVID-19 vaccine doses next week that we will be able to start opening some of our mega sites earlier than scheduled. 3 sites, the Toronto Congress Centre in Etobicoke, the Scarborough Town Centre site, and the Metro Toronto Convention Centre site will be opening on March 17th to vaccinate people 80 years of age and older. These openings, 2 weeks ahead of schedule, are possible thanks to a shipment of 17,500 doses coming directly to Toronto Public Health next week. The opening of these larger vaccination sites will represent an expansion of the network of hospital-based clinics and community and mobile initiatives now underway, and will be further expanded to include pharmacies as that pilot project proceeds. Our immunization task force has also been told to expect a larger shipment of more than 70,000 doses at the end of this month, but not before the end of this month as currently scheduled. We expect to have the remaining 6 large city-run clinics open in the coming weeks, conditional upon this vaccine supply being available. All of them are already in an advanced state of readiness pending availability of supply. And when I make reference to advanced state of readiness, in the case of many of them, if you were to go there and look in the door, in fact, if the door were opened, you'd see everything ready to go. Furniture in place, a lot of staffing arrangements have been made, and so on. That is on top of the ongoing work by our hospital partners and community health centres to get people vaccinated. They've been doing a terrific job. As you know, the vaccine supply is secured by the Government of Canada and distributed by the Government of Ontario. In anticipation that they will be able to deliver more and more doses in the coming months, we are putting in place plans to maximize all of these mega sites. Over the weekend, the Immunization Task Force was briefed on a plan to almost double the number of doses administered each month at the 9 city-run immunization clinics, from around 500,000 doses to almost 1 million doses each month, again conditional on supply. This is a good plan, and I'm absolutely confident it will work as long as we get the vaccine doses. I want to thank Chief Pegg, Dr. de Villa, and everyone involved in the planning around our immunization efforts. And I also want to thank once again our hospital partners and all healthcare partners and community organizations across the city who are doing all that they can, working with us as a team, one team for Toronto, to get people vaccinated. I can assure you, when the supply is there, we will be able to respond, and we will respond. This truly is a Team Toronto effort, and we are all determined to get people vaccinated as fast as we can and as fast as the supply of vaccine allows. After a year of combating COVID-19, this vaccine news is great news. It's fantastic news. It means we are making important progress towards making sure that everyone who wants the vaccine gets it. Every shot in the arm is a step towards putting this pandemic behind us and addressing a number of the myriad of issues that people have out there, whether it be business issues or personal issues or issue with the color of zone that we happen to be in at any point in time. This is going to be a key step forward that's going to help us address many, many of those problems. I'd now like to ask Chief Pegg to give his report from the Immunization Task Force and to provide further details with our thanks. I'm sure I speak on behalf of all of you in thanking him and his team and Dr. de Villa for all the hard work they've done to pick up the pace of what it is we're able to do as a city, thanks to having some additional supply.
Thank you, Mayor Tory. Before I begin this afternoon, I too would like to acknowledge the importance of International Women's Day. I am privileged to work alongside a number of incredible women each and every day, from first responders to senior executives and medical doctors to those working on the front lines of the battle against COVID-19. I would like to take this opportunity to acknowledge the unwavering leadership and dedication made visible each and every day by truly extraordinary women. We need only to look at the right side of this table to understand how unmistakable this is for us all. Thank you for all you do and for paving the way for an even brighter future for us all. From the outset of COVID-19 in Toronto, we have developed incident management systems and processes that enable timely and effective responses to the rapidly changing circumstances that have presented themselves. I'm very pleased to advise that our team is now responding to rapidly developing good news. Next week, as Mayor Tory announced, the City of Toronto will begin to receive much larger regular allocations of COVID-19 vaccine from the Province of Ontario for administration in city-operated mass immunization clinics. The Province of Ontario has indicated that a combination of Moderna and Pfizer vaccine will roll out to both city-operated and healthcare partner clinics as follows. On the week of March 15th, 17,500 doses. On the week of March 22nd, 98,920 doses. On the week of March 29th, 174,200 doses. On the week of April 5th, 80,730 doses. And on the week of April 12th, a further 80,730 doses. Thereafter, we will continue to receive allocations of COVID-19 vaccine in order to enable the accelerated administration of COVID-19 immunization across Toronto. As a result of this increased allocation of vaccine, as Mayor Tory advised, I'm very pleased that we will be opening 3 city-operated mass immunization clinics next week, more than 2 weeks ahead of schedule. On March 17, the following city-operated COVID-19 immunization clinics will begin initial vaccinations for Toronto residents 80 years of age or older: Metro Toronto Convention Centre, Scarborough Town Centre, and the Toronto Congress Centre. Beginning March 17th, these clinics will operate 7 days per week, from 11 a.m. through 8 p.m. daily. We continue to prepare our network of 9 fixed location immunization clinics, which will be augmented and supported by mobile and partner-operated clinics. As previously announced, the Provincial Clinic registration and scheduling system is to come online on March 15th. However, in order to avoid delaying the launch of city-run clinic operations, we are working with our provincial partners to establish an interim registration and booking process for these three initial clinics. This interim solution will build on our previous proof of concept clinic operational plans. Our teams are hard at work now, finalizing all of these details, which will be shared in the coming days, including when eligible residents will be able to begin booking their appointments and how they will go about doing so. Our clinic operational plans are fully scalable, and we have plans in place to be able to increase the number of vaccines that are able to be administered in the city-operated clinics to approximately 975,000 doses per month, as vaccine availability permits. Further, from the outset of our planning operations, we have included plans to be able to expand the hours of clinic operations as required, including the expansion to 24-hour operations. At the point where we are administering approximately 500,000 doses of vaccine per month, our Immunization Task Force Command Team will give careful consideration to expanding the hours of clinic operations in a manner consistent with both vaccine availability and resident need. Building, implementing, and operating plans of this complexity and magnitude require an extraordinary effort. I thank everyone for their patience as we finalize the specifics relating to the interim registration and scheduling system, and I look forward to sharing more details with you shortly. Currently, our hospital partners continue to vaccinate priority groups identified by the Province of Ontario. Vaccine supply is allocated directly to the hospitals in Toronto by the province. Today, our hospital partners announced a streamlined registration system for eligible residents who wish to register for vaccination at a hospital or Ontario Health Team partner-operated clinic. This system is now available at vaccineto.ca. As this system was just launched today, people are asked to be patient as they may encounter some delays in registering. As vaccine supply continues to increase, and in addition to the 9 city-operated clinics that are being prepared for operation, there are plans in place with our partners for approximately 350 additional clinics, including 49 clinics that will be operated by hospital and Ontario Health Team partners, 46 clinics that will be operated by community health centres, and 249 clinics that will be operated by pharmacies. This extensive network of COVID-19 immunization clinics, which will also include primary care physicians, will ensure that vaccines are widely available across the City of Toronto as very soon as vaccine availability permits. I am blessed to work alongside a team of truly dedicated and talented people who continue to give their all every day. I would like to extend my sincere personal thanks to our entire team, who are working day and night to bring the total City of Toronto COVID-19 immunization plan to reality. The COVID-19 pandemic has taken an immense toll on us all, and the impacts on our residents and businesses have been truly unprecedented. Our ability to accelerate the opening of city-operated COVID-19 immunization clinics next week represents a very bright light on the horizon. Thank you for continuing to help fight COVID-19, and thank you for your continued patience as we have waited for the arrival of more vaccine. As we begin to receive more vaccine next week, with even more to follow, we will move much closer to the day when COVID-19 will be behind us, and when we can all return to life in our city that we all miss so much. Please continue to monitor toronto.ca/COVID-19 for the most up-to-date information on the immunization effort in our city. Thank you. I'll now invite Dr. de Villa to bring her remarks.
Thank you, Chief Pegg. Good afternoon and happy International Women's Day to all. Today, I'm reporting 636 new cases of COVID-19. 257 people are in hospital, and 53 people are in the ICU. I'm sorry to have to report 4 new deaths. I'll discuss the status of variants at the end of my remarks, but first, I want to show you a graph that illustrates the impact of vaccines. This graph is about cases in long-term care and retirement homes in Toronto. You see the trend follows the general rise in cases that we saw in December and the new year throughout Toronto. By the week of January the 3rd, there were over 300 cases in long-term care and retirement home residents. But at the tailing end of the graph, we see, with vaccination completed, that the case counts are very small. The week of February 21st saw 2 cases in residents within Toronto's 80 retirement homes and 87 long-term care homes. That is exactly the kind of outcome we hope for following a vaccination campaign. I also want to speak to an anecdotal story from a long-term care home with about 100 residents, where by mid-February, 91% of those residents had received 2-dose immunization, as had about 70% of staff. Nonetheless, 7 cases were identified in unimmunized staff in late February, and 6 of 7 are variants of concern. To date, there are no new reported cases or illnesses amongst immunized staff and residents, and there have been no new cases linked to this home in the past week. There are 4 viable vaccines approved in Canada. I know there is discussion that some vaccines are seen as better or stronger than others. This is usually based on descriptions of each vaccine's overall efficacy. There are 2 points I wish to make in that respect. First, as Medical Officer of Health, I can promise you I am immersed in information about the vaccines. Let me say as plainly as possible that when it's my turn for a vaccine, I would happily receive any of the 4 with complete confidence. Second, the data shows that all 4 work equally well at preventing serious illness requiring hospitalization and at preventing serious illness resulting in death. That's what we must really prevent. That's the level of protection that matters. So I encourage you to get your vaccination when your turn comes, with confidence in the vaccine you're receiving. If you are vaccinated, you can have confidence that you are protected against the worst. Finally, I want to say something really important to remember in terms of taking care of your own health right now. These are exciting and promising times with vaccine supply on the increase. But please, don't mistake progress for completion. We have a ways to go yet, and I want to remind you, and we've seen this before, if we give COVID-19 an inch, it will take a mile. It will take any opportunity to establish itself and spread. So I have to ask you for more patience while we get millions of people in Toronto vaccinated. We will get there. But in the meantime, I see protective measures like masks and physical distancing being abandoned in many places, particularly in the United States. And while I understand the weariness, I also know the reality. COVID-19 has not gone away. It and its variants are still out there, just looking for a person to infect. 2,004 cases have screened positive for mutations and are expected to be confirmed as variants of concern in Toronto. A week ago, that number was 1,179. So we have come perilously close to almost doubling this count within a week. And our calculated doubling time is now at 9 days. While our last full week of data showed that 32% of COVID-19 cases involved a variant, preliminary data from the most recent period suggests almost 40% of our reported cases are now being screened positive as a variant of concern. The Scripps Research Institute and the Center for Infectious Disease Research and Policy at the University of Minnesota found in all countries where variants caused threatening resurgences. In each instance, it was when variants comprised 50% of all viruses identified. Beyond the threat of spread due to increased transmissibility, I also worry about the potential effect of variants on the vaccines. The risk is somewhat analogous to antibiotic resistance, which we all understand. Overuse of antibiotics has reduced the ability of many of those vital drugs to fight infection. In the same sense, we have seen the adaptability of the coronavirus as it spreads from one person to another. But a virus that isn't being transmitted is a virus that doesn't get the opportunity to mutate. The vaccines are powerful, but they are not beyond challenge. I have confidence the vaccine platforms can be adapted to counter variants, but we must absolutely play our part. We cannot take the promise of vaccines for granted. We have to be able to rely on the power of the vaccines to protect us. Forcing COVID-19 into decline is achievable. We're seeing it already in our long-term care and retirement home residents. In this transition phase toward a vaccinated majority, it requires us to continue taking steps to protect ourselves, those who matter to us most, and by extension, everyone else around us. With that, I'll now hand it over to Brad so that we can take some questions.
Thank you very much, Dr. de Villa. Before we go to questions, just a reminder to please unmute yourself so we can hear your question, and we'll go first to Brian Passafume from the Toronto Sun. Go ahead, Brian.
Yeah, good Monday afternoon, everybody. Hope everybody had a great weekend. Hey, my first question. First of all, you're going to have some great news here regarding the city getting some more vaccine doses. It's a long time coming, and I think everybody in the city is glad about that. But how does this impact the delivery of vaccines to frontline workers? I've spoken to a lot of city paramedics who are concerned that despite being on the literal front lines of this fight, intubating patients, performing CPR, doing a lot of things that are kicking up a lot of aerosolized virus particles, there's still paramedics who haven't received their first dose, and seeing others in less exposed positions getting the shot ahead of them. What is the city doing to ensure that frontline medical workers are getting their shot and will get their shot?
So Brian, why don't I take the first kick at answering your question? I would say this. Clearly our interest, along with our vaccinating partners in the health system, is to provide vaccines as quickly as possible to all those in the city who would like to receive that vaccine. And clearly our healthcare workers, particularly those who have been on the front lines and are exposed to the risk of COVID-19 in their daily work, they're high on our list of priorities as per the provincial prioritization framework. Supply has been a challenge, and with the good news around supply, there's no question this will allow us as a group of vaccinating partners across the city to provide greater access to vaccine to all those who are interested in getting that vaccine in accordance with the prioritization framework as laid out by the province.
Okay, this is not my second question, but I just wanted to clarify to get an answer for my first question. What is the city doing to ensure that paramedics are getting their shots and will be getting their first shot once these new vaccines arrive?
So, Brian, the further answer to your question is continuing to work with our healthcare partners to actually stand up clinics throughout the city that allow people to access vaccine. That absolutely includes paramedics and all other parties who are interested in receiving vaccine. But of course, that has to be provided in accordance with the provincial prioritization framework. We are looking forward to providing vaccine to everybody who wants one as soon as that is actually possible. And vaccine supply has been one of the major barriers to date. Now that barrier is soon to be relieved, and we look forward to being able to provide those vaccines.
I'll give you that one, Brian. Go ahead for a second follow-up then.
Okay, thanks. My second question is to the mayor, whoever wanted to answer. You probably read my colleague Sue-Ann Levy's column in today's Sun about the horrors that the pandemic has inflicted in Ontario's long-term care homes, including the loss of her own father. As one of the larger, if not the largest, long-term care home provider in Toronto, what lessons has the city learned from COVID-19?
Well, I'll start by simply saying that we didn't wait until the pandemic was over to learn those lessons. In fact, in the spring, I asked for and received a very excellent report compiled by Paul Raftis, who is responsible for this area of care of seniors and long-term care operated by the city. And we actually didn't even wait for that report to begin to make changes in how we staffed those long-term care residences. We tried to make arrangements as best we could, given some of the physical realities of those buildings, the structural reality of those buildings, to try and separate people from one another, recognizing that was a challenge for us because you could move people into common areas and so on. But the buildings are the buildings, but we made a number of changes, and in fact that report, I think, stands on the public record as something that I know others have accessed as a means of trying to address some of those kinds of concerns, which included the movement of people in and out, not just staff, of those long-term care residences. And so I think that we've made significant improvements since that time and for that matter, recognized as well in terms of even having some technology that's made available to the residents, for example, from having learned from the fact that many of them were lonely and not able to be in contact with anybody in their family during the time of the most acute phases of the pandemic. So there's a whole lot of lessons, and I think they're quite well cataloged in that report. We have a lot of work left to do on our front, where I think our homes are generally regarded as being relatively well run and with somewhat better results in many instances, but we want to keep improving them. And I think there are going to have to be broader changes across the sector, some of which will coincide with things we've already done as a city.
Thank you. We'll go next to Matt Bingley from Global News. Matt?
Hi, good afternoon. My first question is for Chief Pegg. Just in regards to the interim booking system that you're talking about using leading up to the 17th, I'm just wondering what it is that you'll be using. How confident are you that it will not run into any of those new issues that the provincial system was worried about? And if you actually did reach out to the province to ask if you could have early access to the system that they are using?
Sure. Thanks very much. We are absolutely working with the province of Ontario, with our provincial partners, to both create and launch this interim solution. And it's important to note that this is really this is a solution that needs to bridge a very small gap, although a very important gap, between, in essence, this week and the launch of the provincial booking system on March the 15th. This is a system that builds upon and leverages the lessons learned and builds upon the pre-existing frameworks that we had put in place in January and February for our initial proof of concept clinic operations. And the details, the fine details of that are very much still being worked out, and I do look forward to being able to share them with you in the next couple of days, and I commit certainly to doing that. Last part of your question, I am confident that that what is being worked out will meet our needs. There are literally some of the sharpest technology minds that we have been able to assemble, both on our team and at in our provincial, the network of our provincial partners, in order who are working together in order to build this. And there is no doubt, Matt, that we are acutely aware here in the City of Toronto. Our provincial partners are also acutely aware of the importance of this, and we're working diligently to make this happen at what amounts to more than 2 weeks early. And that's a big lift. It was a very heavy lift to accelerate this, but frankly, I would not rather have any other problem at this point beyond having to deal with the acceleration of operations in response to the arrival of vaccines. So we're going to get this done.
Okay, thank you for that. Dr. de Villa, I'm just wondering, when you talk about the variant cases, again, I'm wondering if you can tell us how many of those screened cases or even positive cases are actual active cases in the city at the moment, and how much you see the arrival of vaccines versus the variants as a bit of a race against time at the moment.
So, Matt, unfortunately, I don't have information to specifically answer your first question. We do know, though, that when we were talking about, in my remarks, I referred to how roughly 40% of the most recent cases do screen positive. So those are active cases, as they're relatively recently reported to us. So I do think we need to be quite concerned about variants of concern, just based on our own experience and the experiences of jurisdictions in and around the province, and certainly beyond. We know that parts of Western Europe, notably the United Kingdom, have had significant challenges related to B117, sometimes called the UK variant. These are the kinds of things that we're constantly watching and seeking to learn from, right? We need to learn from the experiences of those jurisdictions that are a little bit ahead of us in respect of their experiences. When it comes to vaccines, as I mentioned, there's lots of reason for promise, and there's hope certainly on the horizon. And the best thing that we can do to maximize the opportunity for that hope to actually be realized in its full potential is to minimize the spread of disease right now. And we know what that comes down to. It comes down to the measures for self-protection that we've all become so familiar with. And yes, as I mentioned in my remarks, we are, I think, increasingly weary of the measures that we have to undertake in order to reduce the spread of COVID-19, but we are almost there. Just a little bit more. We know the measures work, and we have good reason to have faith in the vaccine. So, we have lots of promise and lots of hope. We just need to hang on, continue to practice those self-protection measures, get the vaccine when your opportunity or turn comes around. And then, as the Chief mentioned in his remarks, I think we will, as soon as possible, find ourselves in that circumstance where we're able to enjoy life in our city more like we used to.
Thank you. We'll go next to John Chidley-Hill from the Canadian Press. John, go ahead, please.
Good afternoon, everyone. My first question is for Mayor Tory. Mr. Mayor, the city moved to the gray zone, and some stores have reopened to limited capacity, and malls like Yorkdale and the Eden Centre have reopened. How important is it for the local economy to have some businesses return to some semblance of normalcy?
I think this development that took place today was extremely important, but we've had to look at it all the way along in the context of public health and a number of other things. The reality of what's going on in the rest of the region, where they had moved to a different stage in most cases before we had. The realities of the faced by businesses, which were really struggling, and I think, we obviously had to look first and foremost at the public health situation, where I think based on the advice of Dr. de Villa and all the other people that we speak to about these matters, it was deemed in the overall best interest of Toronto that we could move to grey. I wouldn't have supported the recommendation if I hadn't thought that was the case, and I'm sure it wouldn't have been made. But it was very, very important because I think both in the context of the state of business and overall good health of people, as it were, and in the context of the sort of psychology of the public that we, together with vaccines, appeared to be, as public health circumstances permitted, moving back in the direction of something that would ultimately lead to a more normal state of affairs.
Thank you. My second question is for Dr. de Villa. Doctor, I was curious if you're frustrated or how frustrated you are with these ongoing data cleanup issues, especially on a day like today where data that accurately reflects the current situation is important for Torontonians to make decisions, like if they want to go out shopping, if they should have a socially distant visit with a friend or relative, that sort of thing.
So I guess a couple of things. You were talking about frustration around data issues?
Yeah, the ongoing data cleanup that continues to sometimes create seemingly false, well, not false, but surges in the daily COVID-19 numbers, the case counts, and how accurate information is needed for everyday citizens to make decisions about how to best run their lives.
Yeah, so thanks for that question and for the clarification. I would say this, clearly being able to provide clear, accurate information for people to act on, whether we're talking about public health practitioners or people in their daily lives, I think is an important component here. And it is one that I know that we have really tried to keep up with as much as possible. We have put a great deal of information out in as close to real time as possible, certainly ourselves at Toronto Public Health. I know that our provincial counterparts have done the same. But just like everybody else, whether it's within the context of government, the private sector, or in your personal life, we all sometimes have challenges with our technology and the systems that support the work that we do or whatever activity it is that we're undertaking. And, you know, my understanding is that there were some challenges experienced by our provincial counterparts today on the data system. This is unfortunate, but, you know, I know that they have worked very hard, as we all do when those situations arise, to correct things as quickly as possible and to provide information as quickly as possible to the public, who can then make the best decisions. So this is something that's constantly at the top of mind and something that we're all constantly working on to improve each and every day.
Thank you. We'll go next to Jessica Ng from CBC News. Jessica, go ahead, please.
Good afternoon. Can you tell us a little bit about the vaccine TO portal that launched today and why it was created ahead of the vaccine registration system that's going to be set up by the province?
Sure, Jessica. I'll do my best to give you an overview. So the vaccine TO portal is something that has been created by our hospital and healthcare partners in an effort to assist residents in accessing the ability or in making their own individual appointments for vaccine in clinics that they operate, they being hospital and healthcare partners. So we appreciate, and I certainly appreciate, that the timing of all of this and the ability to communicate it clearly can often be a challenge. But I think that I certainly give them credit. I give all of our partners credit for making the effort to do this and to do it at what we somewhat not so affectionately refer to as at the speed of COVID. There's a lot happening very quickly, and there are a lot of really good people on those healthcare and hospital teams who are simply doing the very best they can do to make the process as easy and as transparent and accessible to our residents as possible. They launched that today. We're certainly happy to support that. And that, of course, will, in short order, be augmented by the provincial registration system that will come online. And it is that system, the provincial booking system, that we, the City of Toronto, will leverage for all scheduling activities for city-operated immunization clinics. But we're certainly working together in one effort, one Team Toronto effort, if you will, in order to drive the vaccine process and make vaccine as available as very soon as possible.
Thank you. And second question, when you're going through the vaccine TO portal there, you can see what groups are being prioritized by different hospitals. Now, why is it that some Toronto hospitals are prioritizing homeless residents and some are not?
So with respect to the priority populations that are being provided vaccine by our hospital partners and our health system partners writ large, effectively what they're doing is that they're following the provincial prioritization framework. And this is the nature of the collaboration and teamwork that is being done across the city with all the healthcare partners, ourselves included. So some hospitals have access and have particular relationships with providers who are better suited or have established relationships with different subpopulations. They've taken on certain subpopulations in terms of vaccinating them, and other hospitals have taken on other partners. I think it's just a reflection of divvying up, if you will, the responsibilities across the many different partners so that we can get the job done as quickly as possible, as efficiently as possible, and as effectively as possible.
Great. Thank you very much. We'll go next to David Ryder from the Toronto Star. Dave, go ahead.
Hi, everybody. Excuse me. Dr. de Villa, can I just follow on the earlier question about today's number, which seems a lot higher than in recent days? Is that strictly a matter of a data issue? Because some experts are pointing at, if not a stagnating number in Toronto, potentially with the variants going up. There's some talk about possibly even being in a third wave or following some of the worst trajectory we've seen from modeling. Can you kind of address that issue?
So, Dave, I will try to address the issue. I don't know that I can answer the, with, complete certainty. That's sort of the nature of a pandemic. I would say this: there were some data issues reported through our provincial counterparts. That certainly is part of the issue. I would also say, though, that as we have noted throughout the course of the pandemic, one day of data does not a trend make. So I can assure you, we are constantly monitoring that which is happening. We are obviously, keeping an eye on our case counts, observing that which is happening with our reproductive number. All of the different indicators as carried on our website that's at least a subset of the indicators that we're constantly monitoring to ensure that we have a handle on what's happening here in the city and are providing the best advice that we can, premised on the best available evidence around what to do. But certainly there are some data issues that were reported by our provincial counterparts. That's part of the reason behind today's number. I don't know that it's the whole of it, and I think what we'll need to do is continue to observe, continue to be vigilant, and again, I would ask people to continue to practice those measures for self-protection. That is still fundamentally what we can all do in order to reduce the spread of COVID-19 until such time as we can get vaccine out there to everybody. Thank
you. My follow-up question is about the clinics possibly going 24 hours. It sounded last week we heard from Mayor Tory and Councillor Cressy that it seemed like almost certain. This morning, I think on CP24, I heard maybe a more cautious approach from Mayor Tory, and today we're hearing about certain thresholds. Can somebody elaborate exactly whether we'll know when there are going to be 24-hour clinics, and also if somebody can just answer when the city portal will be alive? Thank you.
Sure, David. I'm happy to talk about clinic scheduling. So we, from the start of our planning operations with respect to city-operated immunization clinics, we have embedded and given consideration to the eventual potential to expand hours of operation, and that those may be partial expansions, or we have given consideration and in fact have plans in place to be able to expand to 24 hours. There are a couple of key drivers that would inform that decision. The first driver is, in order to expand clinic operations, of course, there needs to be a corresponding increase in the availability of vaccine. So there would be no net benefit, no value to expanding the operation hours of any particular clinic if we can't support those expanded hours, match that, if you will, with vaccine. So that's condition number one, and that's something that would be monitored. As I stated in my remarks, we know based on the tactical and operational plans for the deployment of the clinic, our network of 9 clinics, we have capacity right now to reach nearly 1 million doses a month. 975,000, I believe, off the top of my head, is what our planned capacity is at the planned hours of operation. So once we hit what we have decided through the Immunization Task Force Command Team, at the point where we hit approximately 500,000 doses a month, that would be the point at which the command team would start to evaluate things like the future availability of vaccine against both operational need, client or resident demand, and all of those various factors. And at that point in time, we may well make the decision, and I may well make a recommendation to the command team to expand clinic operations, and that may well include 24 hours. But at this point in time, what's most important is that we get the network of clinics running, that they are operating effectively, and that we're delivering the maximum amount of vaccine in the shortest amount of time so that the maximum number of residents are able to be immunized as very quickly as possible.
And David, may I just comment on the sequencing of that? The system worked exactly as it's supposed to. We indicated an interest in having that option remain on the table, which it still is, subject to the comments that the chief made, but we asked him to look into it. He reported back to us at a meeting we had on the weekend, and my comments this morning, 3 days later, simply reflected the report that he's given, which he's largely summarized for you.
David, on the booking system that you asked about, we will have more information and details on that in the next couple of days ahead of the clinics opening the city clinics opening on the 17th. We'll go next to Jennifer Pagliaro from the Toronto Star. Jen, go ahead.
Hey there. I had just a clarification question for Chief Pegg. I heard you say in answer to Matt's question that the health partner interim site is really just a stopgap until the provincial system goes online. So if someone is looking in the 80+ eligibility to book a vaccine after March 15th, are you saying that those health partners will no longer offer booking on their sites? Because you can see where the confusion might be. Like, I can go to UHN site and try to book my grandparents in there, or I could go to the provincial site, which might be overloaded in the first week or so. So just wondering for people who are really preparing and anxious about this, what they should expect.
Yeah, Jennifer, thank you for the question and clarification. And please allow me to clarify, because it seems that I may have been inadvertently unclear. The system, the vaccine TO portal or system that our hospital and healthcare partners launched today is in fact theirs. That is a system that consortium, that group of professionals have put together in an effort to assist people in making appointments in hospital-operated clinics and Ontario Health Team-operated clinics, and something that we applaud and we certainly support. When I made reference to interim, what I'm referring to is the solution that we are building, that we actually just spoke about. The only thing that is interim is the interim solution that will be assembled and launched in advance and in support of the opening of the 3 city-operated clinics on March the 17th. That is interim in that it will operate for a number of days up until the point of March 15th, when the overarching provincial scheduling system comes online. And the city-operated clinics will use, our clinics will be fully supported by the provincial booking system that comes online on the 15th of March. So my apologies if I was unclear.
That makes more sense. Thank you very much. And just in terms of, I just wanted to follow up on Dave's question about 24/7. I know you're saying that you just want to make sure you can maximize the full shipment in the time you have allotted. But wouldn't it technically be faster to scale up to 24 hours as soon as possible? Like, is that a resource issue? Because obviously there are lots of people who would take an appointment later in the evening if it was available.
Sure. Let me take a shot, Jennifer. So there are a number of factors that go into any any clinic, it's actually well outside of any clinic, any operating model that looks at scheduling over time. One factor certainly is the availability of vaccine. And if you consider that our clinics are both scaled and paced, I apologize for all the technical terms, but we have scaled and paced our clinic model in order to ensure that we are able to deliver the maximum quantity of vaccine in the shortest amount of time, while concurrently ensuring that the client experience is appropriate, that we are taking every precaution and making sure that we are protecting the health and safety of everyone that enters a clinic, as well as the staff working in the clinic, and while ensuring that we are able to maintain the highest standards of infection prevention and control. So those are all factors that exist. When you layer that on top of the fact that we simply need the right quantity of vaccine to administer, if we had no additional vaccine and we simply extended out or expanded out the number of hours that the clinic was open, it would simply mean that we would administer the same quantity of vaccine over a longer period of time. So there's really a trade-off that happens. We're excited. I look forward to the day when I can report back to Mayor Tory and the Immunization Task Force Command Team that we are at a point where vaccine availability enables us at that point to consider expanding operations. That will be a good day. And we are working really hard, and I can assure you that our team has plans in place to expand those operations, and that would include up to and including 24-hour operations.
Okay, thank you. We go next to Jason Chapman from 640 Toronto. Go ahead, Jason.
Thanks so much, Brad. I believe the question is for Dr. de Villa. I want to talk about the approach that Toronto continues to take versus other parts of the GTA towards keeping COVID numbers in check. There's been a lot of talk about the measures that are in place to protect people. But Dr. de Villa, our newsroom today looked at the numbers out of York. York has been in the red zone for 2 weeks, and we were curious to see that their reproduction value is below 0.9. Their cases are 7.9 per 100,000. About a week ago, I asked a question about some think pieces being, talking about letting people make smart decisions instead of taking everything away. In the gray zone, we're still in lockdown in Toronto, and that means there's a lot of things people still can't do. And I know that the province sets out those parameters, but Dr. de Villa, you've asked that we stay in the gray zone. So when I look at those York numbers and I look at Toronto's numbers, I want to ask, do you think it was a mistake to keep us in stay at home as long as we were in stay at home, because it made people make riskier decisions instead of giving them more choice where there's less chance of spreading the virus?
So, Jason, there's a lot in that question. I'll try to tackle it in reasonable time. First and foremost, I can't comment on York's numbers. I admit I don't keep up with their data. And if they are doing well, certainly, what I would like to see is an improvement in all of our numbers across the board, whether we're talking about Toronto or any other jurisdiction in the province. Clearly, that's where I would like to see us all go. There's no question that we would like to all put the COVID-19 pandemic behind us as quickly as possible. And what we are doing here in Toronto is consistent with the evidence that supports that putting the pandemic behind us as quickly as possible. I don't think there's any evidence, and I would be interested in seeing if there is any evidence that suggests that our current circumstances have given rise to riskier behavior. I would say that there is a significant body of evidence around what is the best practice in terms of reducing the transmission of COVID-19 within the context of any given jurisdiction. And what has been shown is that what's required when it comes to reopening is to do so slowly, cautiously, and carefully, particularly in light of the emergence of variants of concern, which we know are figuring more prominently here, certainly in Toronto, and in other jurisdictions around the province.
Thanks for that. My follow-up is, 3 weeks ago, you mentioned that you were, I believe the quote was that you were more worried than ever before in the pandemic. I'm curious if you still stand by those comments as we have seen the last 3 weeks play out.
So, I was very, very concerned at that time, and I still stand by those comments because that reflected my perspective at the time. I do think we have to look at the experiences of jurisdictions all around the world. And as of late, in the last few weeks, we have seen the rise of variants of concern, particularly the B117, also known as the UK variant, in a number of different jurisdictions throughout Europe. Beyond the UK. Certainly we know the UK had to go into significant shutdown and is just starting to emerge from a nationwide lockdown associated with the resurgence of cases that resulted when B117 became the dominant strain in that environment. Many, many other countries are finding themselves in that precarious situation. Some, were declining in terms of overall COVID-19 cases, and now are starting to see either a plateau in that decline or in fact are starting to see that rise in cases as was witnessed in the United Kingdom itself back in December, early January. So we are still in a very precarious situation. We know that variants of concern are on the rise here, and as I mentioned in my remarks, the most recent data suggests that, in and around 40% of our cases are actually screening positive for variants of concern. But at the same time, we have the hope of vaccines just on the horizon. You've been hearing us speak here about, the newly secured supply, which is more stable on the go-forward basis for a number of weeks, which is good news. So, my plea to the people of Toronto is to continue to be vigilant around practicing self-protection measures. They remain one of our strongest defenses against the spread of COVID-19 and the negative impact that it has on us. And beyond that, as vaccine becomes more available and as we're able to get more vaccine into arms, taking these two things together, ongoing self-protection measures, increasing vaccine into arms, this is what will see us through and towards the place where we all want to be, which is with COVID-19 in the rearview mirror.
Okay, thank you. We'll go next to Austin Delaney from CTV News. Go ahead, Austin.
Good afternoon. My question is for Dr. de Villa. Doctor, what do you need to see in Toronto to make you feel more comfortable for even fewer restrictions, restaurants opening, going to the red zone?
So I think there are a number of different factors that we're looking at, and that's certainly covered and monitored on our monitoring dashboard on the website. Certainly we want to see the continued decrease in weekly incidence rates per 100,000 population. We want to see that reproductive number coming down, and we want to keep a very, very careful eye on the proportion of our cases that are variants of concern and how much, have a good understanding as to how much transmission is happening within our community. And of course, last but not least, vaccine, right? Vaccine uptake and vaccination coverage across our population. These are the many indicators that we need to be looking at in order to assure ourselves that we're in a better place in order to reopen more fulsomely and to really start to restore life more to something like we knew before COVID-19 was around. I would say, and I'm sure you'll hear, the mayor and others around us say, and I've certainly heard this from the business community directly, that the notion of opening and closing and opening and closing again is the worst possible scenario. So the idea is to make sure that as we, start to emerge and as hope becomes, more of a possibility here in our city with the advance of and the arrival of more and more vaccines, and hopefully with the continued decline of COVID-19, that we will be able to see more activity return to our city, and we'll certainly work with all of our partners to ensure that they're doing that in as safe a manner as is possible.
There's a follow-up. Is there any concern that with the number of variants around?
Austin, hang on one sec, Austin.
Austin,
just one sec. The mayor's gonna...
Just before, I'd like to just comment on that. First of all, we make these decisions as a team, but obviously we rely on those who are expert in health and medicine to advise us with respect to the health considerations, both in respect of the meaning of the numbers, but also in respect of things like the prevalence of the vaccines across the city. But what I also bring to the table, and others who sit as part of these discussions as a team, is considerations, as I've said before, of the psychology of the people, because there can be a circumstance in which things can become less effective over time. The state of the region overall, because we are part of a very big region of a very high population of people. And finally, the state of the economy, with the overriding objective being to make sure that when recommendations are made to the province, because they make the decisions about gray, red, or any other color, that we are able to open and stay open and not have another lockdown. And so those are the discussions we have every single day to one extent or another, and we will continue to have them every single day, because we want, when the time is right, and within the context of that kind of cautious approach Dr. de Villa made reference to that's accepted around the world, we want to do this right, but we want to also do it as soon as we can.
Okay, Austin, thank you.
Then
Go for it. Go ahead.
For both of you, Mr. Mayor, as well, is there a real fear there will be a step backward before there is a step forward?
You know, I think a number of people have heard me say in recent days, and I think I'm quoting Yogi Berra, that prediction is difficult, especially about the future. I don't think any of us has a crystal ball. Certainly, there is reason to be optimistic, given the hope and promise of vaccines. But we also have reason to be cautious, given what we understand of variants of concern, their presence here in our city, and what we have seen has happened in other jurisdictions all around the world as variants of concern have become more prominent and have replaced the existing old strains and become the dominant strain of COVID-19 circulating in those communities. So, you know, I think that it is beholden on all of us to do the best we can to, you know, practice those self-protection measures. We know that this makes a difference. The more we are able to maintain that distance, to wear our masks as much as possible when that distance can't be maintained for those essential activities that need to be done, washing your hands, staying home when you're sick, these are the kinds of things that really do make a difference. We've seen this time and time again. We've also seen that vaccine makes a huge difference. We're actually seeing really remarkable benefits within the context of our long-term care homes and our retirement homes. And this is the exact benefit that we want for everybody in the city to enjoy. So the more we are able to reduce the spread of COVID-19 now, the more effective our vaccines will be, the better they'll be able to do their job, and the sooner we can get back to life more like it was before.
Thank you. We'll go next to Scott Lightfoot from CTV News. Scott?
Thanks, Brett. Question for Chief Pegg. When you open those 3 mass vaccination sites that you mentioned will open initially for over 80s, there's going to be a huge interest. A lot of people are going to want to register and to get vaccinated there. I'm guessing these are for any over 80 person in the city, but are you specifically hoping to target the people in the areas, the regions where these sites are located?
Yeah, thanks very much, Scott. In fact, you'll be happy to know, because I'm proud to tell you that in our planning for these, and obviously somewhat, like we said, with respect to scheduling, still very much ongoing, but we are working diligently with one goal, and that goal is to be able to launch a registration system that ensures that there is scheduling capacity for everyone in that age category across the City of Toronto. That is the planning framework that we established for our team. It is the very operational planning framework that they are working towards today. And like I said, as very soon as we can finalize these details and get them back to you, we will. So unfortunately, there is a little bit of stay tuned, but our goal is to ensure that there are appointments available for every one of our residents 80 years of age or older as we open.
Sorry, maybe I wasn't clear on that. I just meant like the 3 sites that you chose, were those specifically chosen to target those neighborhoods or those areas? Or is the idea that anyone from across the city is equally welcome to access these sites? Like, were you hoping that the people in the areas where these sites that you've chosen to open early will be the ones to get in at those sites?
Oh, my apologies, Scott. We selected the three sites we selected because they represent 3 of the largest sites and the most readily expandable sites in our network of 9. So absolutely intended to facilitate and to serve residents from across the City of Toronto. Just to, I guess, to restate, we selected Metro Convention Centre, Scarborough Town Centre, and Toronto Congress Centre to make as readily accessible and as easily accessible a network as we can make, with the largest, most easily expandable network of clinics that we can operate. So really just trying to do the very best we can do with what we have to offer and put our best foot forward, and I'm confident that we've done that.
I'll give you that one as a clarification. Scott, do you have a second?
Yeah, if I can. You mentioned that the Toronto-specific portal will be operational for a few days, maybe a couple of weeks there. Are you concerned? I know that you mentioned the tech challenges in doing this, and Jennifer mentioned people are going to be trying to sign up their grandparents, but we've seen in other regions, a lot of people over 80 cannot figure these things out. They have difficulty with the internet. So right now there's a myriad of options where you can pre-register at healthcare centers. For a short period, there's going to be the Toronto portal, then there's going to be the provincial portal. Are you sort of concerned that this is going to make this more complicated for people who may not be as tech savvy as the younger generation?
We are certainly acutely aware of the challenge that all of that places on the population, and most certainly our residents over the age of 80. Having said that, there's a couple of things that we're working diligently on. One is being directly connected with our hospital and Ontario Health Care team partners to learn from and leverage their experience. The second is working in continuous contact with our provincial partners to gain the same experience. As we know, there are pilot operations happening in a number of jurisdictions across the province now, so we're able to learn from them and build in, if you will, incorporate those lessons learned into our system. And then simply our commitment is we will do everything we can do to make sure that we're building the best systems that we can possibly deliver, and to make sure that we communicate as very effectively and as very clearly as possible, making sure that we're doing all we can do to make this as accessible as possible. It is a challenge. This is a daunting task. Getting ahead of COVID-19 has been and will continue to be a daunting task for some time, and simply moving through a process whereby we are trying hard and doing everything we can do to deliver vaccines to more than 3 million people in our city as very quickly as possible is no small feat. So we're doing the very best we can do. We're leveraging the best technology and the best technological minds that we have, and ultimately we'll bring forward the very best platform and the very best solution that we can provide to our city.
Okay, thank you. We'll go next to Sean O'Shea from Global News. Sean, go ahead, please.
Thanks very much for taking the call. I appreciate it. This is directed at the mayor. Mayor, my question is about public trust and consequences when it comes to enforcement. We did a story last month about a gym owner who decided to reopen and take clients at his home without any concern about getting charged. There have only been 14 charges out of 900 complaints in the month of February. I'm wondering what you'd say to the public with respect to consequences. What do you think of people who would go to a gym trainer like this, and to somebody who would continue to act in a way that is contrary to the law?
I would say that it is showing disrespect for the law, which is put there to protect their health. I would say it is showing a certain disregard for their own health, and that the trainer in question is showing disregard for the health of his clients. But in the end, it's one of those things where, first of all, we don't direct law enforcement, those of us who are holding elected office. And second, they have to exercise their discretion. I can tell people out there, every single complaint that is registered with us is followed up. And in some cases, when the people arrive from licensing or the police or otherwise, there is nothing going on that contravenes the law at that time, or perhaps there never was. But every single complaint is followed up, and charges are laid on the discretion of law enforcement. And I just hope, and I think it's the case, the vast majority of business people, they wouldn't be complaining about being kept closed, quite frankly, if they were somehow subverting the law. Most people have followed the law to their considerable sacrifice, and we appreciate that, and we appreciate the fact most people who are their clients have followed the law as well, and we'll just have to, try and get out of this situation we're in so that those laws are no longer applicable as soon as the health situation gets better and more vaccines have been administered.
I have a quick follow-up on behalf of a colleague of mine. Mayor Tory, what do you say to business owners in Toronto, on the York-Toronto border, where they're remaining closed according to the law, but just across the border in York, places like hair salons and gyms and that kind of enterprise can be open? What do you say to them today as this drags on?
I would say that I'm sorry that that is the situation that they face, that please be as patient as you can be, knowing they've made tremendous sacrifice already, because the worst nightmare we could face is and my guess is if we ever had to have a shutdown again, it's going to be on both sides of the border between York and Toronto, not just on one. And what we're trying to do in the case of the best interests of our own city is to avoid opening and then having to close again by having a cautious reopening. It started today. Thousands of businesses reopened today in Toronto. And more will open as we go forward and hopefully improve the health numbers and all the other considerations I mentioned earlier on. But what we're trying to do is stop a situation from arising where businesses on both sides of that border have to close again. I think that would be the worst nightmare scenario for most businesses. I think they would agree with that.
Thank you. Final question is Heather Butts from CTV National News. Go ahead, Heather.
Hi, thank you so much for taking my call. My question for you today, I believe, likely directed towards Dr. de Villa. The U.S. CDC released long-awaited guidelines today on how fully vaccinated people can visit safely with others, such as saying fully vaccinated Americans can gather with other vaccinated people indoors without masks. What do you make of the recommendations, and when might we see similar guidelines here?
So I've just had a very quick opportunity to take a look at the CDC guidance, and certainly the Center for Disease Control in the United States is one of the most trusted public health institutions. So I would certainly give this a great deal of weight and consideration. With respect to what might actually happen here, usually these sorts of kinds of advice, this type of guidance is generally provided, more on a provincial or a federal level. I know that these are the kinds of conversations that happen regularly at a number of advisory tables that are organized, certainly at the provincial level. I admit I'm less familiar with that, which is happening at the federal level. But I expect that similar guidance should be issued by those authorities here shortly. But I would expect that which the CDC has put out there would have some weight and would be certainly considered in the deliberations at those tables.
Just one quick follow-up for you. Are you surprised by the fact that they're sort of so freely saying those who are vaccinated can gather without masks? Is that something that you would recommend to people who have been vaccinated?
Well, my sense is that the advice that's been offered by the Centers for Disease Control in the U.S. is premised on the evidence and the experience that they're seeing thus far with vaccine. And I think it speaks to the remarkable impact that vaccine can have, and we should hope to have as we get more vaccine here in our city. I spoke today in my remarks about the incredible impact, the incredible positive impact that vaccine has had on our long-term care home and retirement home residents. This is an incredible success story. I think that's reflected as well in the CDC advice. I assume premised on the evidence that they have seen. And we really look forward to getting to that point. I think it's a good news story, reason for optimism and hope, and all the more reason for us to just push through that last little bit. I know we're weary, but continuing to maintain distance until such time as we're able to get more vaccine into the arms of all those who reside here in Toronto and beyond continues to be really important, so that we can get to this point where we can start to think about enjoying life in interaction with others, and ideally, at least at some times, without masks.
Thank you very much, Dr. de Villa, and thank you for joining us. That concludes today's briefing. Our next scheduled briefing is this Wednesday, March the 10th. Stay well.